Hi, my name is Jasmine Mazer, and I am a second-year occupational therapy student. Today I will be talking about stress of conscience in response to workplace burnout as part of a psychological health and safety in the OT workplace module. So what is burnout? The article that I will be discussing in this presentation is Burnout and Perceptions of Conscience Among Healthcare Personnel, which is a pilot study done by Gustafsson, Eriksson, Strandberg, and Norberg. So burnout, as the definition is here, is emotional exhaustion, which is seen as a chronic state of physical and emotional depletion as a result of demands placed on an individual, and depersonalization, which is dissociation from one's thoughts, where it causes a loss of identity. And so this loss of identity is really important and powerful, as OTs are seen as individuals who help others find roles and identity in their life through occupation. So the point at which an OT loses their sense of self can have a significant impact on their performance and their practice. A study online that Gupta et al. Did reported high levels of emotional exhaustion in over 1/3 of OTs, high levels of cynicism for almost half of OTs, and low professional efficacy for almost 1/4 of OTs in Ontario, demonstrating the need for emphasis on how to treat burnout. Factors contributing to burnout are perceptions of conscience, stress of conscience, moral sensitivity, social support, and resilience, and these will be discussed in the upcoming slides. So perceptions of conscience really depend on the person and if they see their ability to distinguish right from wrong using their intuition and judgment as an asset or a burden. Conscience as an asset is really seeing your conscience as something that you can express in the workplace, and that's something you can follow when performing your work. If you feel that you have to deaden your conscience to keep working in the healthcare system and to really see it as far too strict, this can be associated with emotional exhaustion and depersonalization, which can truly contribute to burnout. Stress of conscience is influenced by lack of time to provide the care needed, so feeling overburdened, work being so demanding that it influences home life, so working long hours, and not being able to live up to the expectations of others. Stress of conscience is associated with emotional exhaustion, which again is that chronic state of physical and emotional depletion due to the demands placed on an individual. Moral sensitivity contributes to awareness of conscience and can help to be genuinely concerned for the welfare of others. This can be related to an imbalance between resources and work demands. Moral sensitivity is positively related to stress of conscience among healthcare personnel at work, and this is associated with emotional exhaustion, meaning that having moral sensitivity to other situations can cause an emotional burden and thus contribute to burnout. Social support has been shown to be a protective factor against work stress. It can work both direct, by reducing a strain of a particular stressor, and a moderating or buffering role by weakening the relationship between stressors and strain. Studies investigating the relationship between social support and burnout have somewhat inconsistent results, but it is still believed to be an important factor. So resilience is how people are able to manage stress and adversities, demonstrating an inner strength. So there are 3 ways a person can do this. This is their recovery, so the ability to come back from these adverse events, restoring balance between the mental aspects of life, and consequently avoiding the negative effect of stress, and their response to stress through resilience using good coping mechanisms. Research has shown that resilience is a protective factor against burnout, and that low levels of resilience are associated with emotional exhaustion. So who does this affect? Clients are impacted by burnout if a therapist is unable to be at their best and help meet the client's needs through the client-therapist relationship. Therapists can be impacted through emotional exhaustion and depersonalization, which again can impact their clients. Relationships with others in the workplace can be impacted if they are feeling that they have a lack of appreciation and respect from coworkers and superiors, and this can impact burnout. And really, it demonstrates the need for feedback of performance and recognition from others to prevent a devalued feeling. Lastly, organizations can help support a strong team by ensuring that everyone is both physically and mentally at their best to impact everyone in this cycle. Ways to address burnout in the workplace relating to stress of conscience is knowing yourself, knowing your abilities, your limitations, and what you're actually able to influence in the workplace. Mentoring and team meetings are really important to have that social support and share a burden so that it reduces and eases a troubled conscience of professionals. And then coping strategies discussed by Gupta et al., where spending time with family, maintaining professional and personal balance, controlling the work responsibilities, maintaining a sense of humor or positive outlook, and self-awareness and self-monitoring. So many factors can influence burnout, and the treatment for burnout can be very complex. So the best course of action is really determining what works best for you, making sure you develop that social support system, and making sure that you can identify when you're reaching that point of burnout. Thank you for your time, and I really hope you enjoyed my presentation. All the best to you in the future.